Now, amongst all of the anxiety patients, there's one particular group that are more anxious and probably more difficult to treat than any other, and that is the patient with a severe gag reflex. There are a whole lot of reasons why people have gag reflexes, and we need to be kind of sensitive about it, because they can have a gag reflex because they've had a near drowning experience. They can have a severe gag reflex because they've been sexually abused. Sometimes they're related to quite traumatic history, so be gentle and sensitive with the patient. Nonetheless, dealing with a gag can be quite tricky and it can be quite stressful for us. So here's some tips for that. The gag reflex is more sensitive the more anxious you become. So it's like bad spiral there, because patients who have gag reflex also tend to be anxious, and the more anxious they become, the worse it gets. So a very simple way to reduce the gag reflex is to sedate, use anxiolysis, or to do a general anaesthetic. So any form of pharmacology that reduces anxiety will also reduce the gag reflex. That's why, for instance, when we get an endoscopy down our throat, we get propofol, which sedates us to the point where we don't gag. Or if we do gag, we don't remember it, which is the same thing from the patient's point of view. Suppress anxiety with pharmacology, the gag reflex reduces, or they don't remember it. Either way is fine. Secondly, in the patients who are not such bad gaggers, you can often resolve it by doing acupuncture right here. Now, if you're going to do acupuncture on a patient, don't get the big needles that you see the Chinese acupuncturists use. They're too dangerous hanging around outside of the patient's mouth, and you'll be too anxious to do anything because you'll be worried you'll whack them with your elbow and knock it in. So, plus they're a bit weird to use. So you can get the really short acupuncture needles on some sticking plaster, and we'll have a link in the description below that will show you where we get them from. Put one right here. I don't think it matters that much where you put it, because I used to put them here and then I put them here and they work just as well. I think it's a placebo effect. It has been shown by the British Dental Journal that it does work in about 80% of cases, but it's probably a placebo. I don't really care. I just know that it helps. Salt on the tongue helps a lot. So we have salt. It doesn't have to be Himalayan pink salt, okay, or whatever. It can just be regular cheap salt. Sprinkle that on the tongue. Acupuncture here. It's important to tell them that the acupuncture thing will reduce their gag reflex, because you want to get maximum placebo effect if it is that. Anesthetizing the tongue helps a lot. So if you're doing a procedure on the lower jaw, then the tongue will be numb. If you're doing a procedure on the upper jaw, sometimes I numb the lower jaw as well, just to anesthetize the tongue so that it's not touchy when things touch it. Most people with a bad gag reflex, if you put a rubber dam on, it stops all the water going down the back of the throat and they feel better. But a small percentage of people, you put a rubber dam on them, they gag immediately and you can't use one. So that will be dependent on the patient. And if you can't do that procedure without a rubber dam, then you need a general anaesthetic or sedation. The last thing is, you have to be a little bit heartless with gaggers. First of all, tell them that it's okay. It's okay to be a gagger. I'm a gagger. Half my staff in the clinic are gaggers. There's nothing wrong with you. You're not weak. You're not useless. It's not because you're not strong enough that you have a gag reflex. It just is. It's like you can't stick your finger in your eye without blinking. It's the same thing. So it's okay to be a gagger. But if you're going to take an impression on a gagger, be ruthless. Fill the tray up properly, because there's nothing worse than when you take an impression and you didn't get it properly and you have to take it another time. So that's a key part with gaggers. If you're going to take an impression, fill the tray up properly and get it first go, and just have a bucket ready so that if they vomit, they vomit. Okay, but it doesn't happen that often. In summary with the gagger, sedate them. Anxiolysis, general anaesthetic. Don't spend an entire appointment fighting with someone with a gag reflex. If you can't treat them easily, just stop. Get them back another day and work out whatever pharmacology you need to get the procedure done comfortably for them, so that it's also comfortable for you. Now, if they say, I don't want to take any sort of medication, I just want to deal with it, but you can't do the treatment, just say no. Like, you can't go to the orthopedic surgeon and say, I want my hip replacement done under local anaesthetic. You don't get that choice. You're a surgeon, act like one, tell the patient how it's going to be done and what medication you need to get them comfortable and to get you comfortable.